Imagine a shiny gray metal quietly occupying its spot on the periodic table at atomic number 78. Platinum is rare, unreactive, and almost completely inert, yet this unassuming element is at the heart of one of the most important cancer treatments in history. Today, we'll journey through the fascinating story of platinum coordination compounds, how a chance discovery led to a revolution in cancer therapy, how these drugs work at the cellular level, and where the science is heading next. Welcome to Onco-Verse, where we uncover the hidden stories behind medical breakthroughs. The 1960s, biophysicist Barnett Rosenberg was investigating how electric fields affect bacterial growth. He used platinum electrodes believing they were chemically inert to pass current through a bacterial culture. To his surprise, the bacteria stopped dividing entirely. It turned out the platinum electrodes had reacted with the salts in the solution, forming a small platinum compound that blocked cell division. Rosenberg followed this unexpected lead, and by the early 1970s, the compound was named Cisplatin. This accidental discovery would go on to save countless lives and open the door to a whole new class of cancer medicines. Cisplatin's effectiveness comes down to its unique structure. It's a square planar platinum Roman II complex with a central platinum atom bonded to two amine groups and two chloride atoms all in the same plane. This precise geometry isn't just a chemical curiosity, it's the key to the drug's anti-cancer activity. If you change the arrangement of these atoms, the molecule loses its ability to fight cancer. This is a perfect example of how, in chemistry, even small changes in structure can have huge effects on function. Cisplatin enters a cell, it encounters a much lower chloride concentration than in the bloodstream. This causes its chloride atoms to be replaced by water molecules, a process called equation. The result is a highly reactive, positively charged platinum species. This activated form binds to the guanine bases in DNA, forming crosslinks between neighboring DNA strands. These crosslinks twist and distort the DNA helix, making it impossible for cancer cells to replicate their DNA properly. If the cell can't repair this damage, it triggers programmed cell death. Cisplatin also interacts with proteins, which adds to both its effectiveness and its side effects. Cisplatin transformed the outlook for metastatic testicular cancer, turning a nearly fatal diagnosis into one of the most curable solid tumors, with cure rates now above 90%. It's also a backbone treatment for ovarian, bladder, lung, esophageal, gastric, liver, and head and neck cancers. Cisplatin stays in the body for a long time with a half-life of about 72 hours and is slowly cleared by the kidneys. Its broad effectiveness has made it a mainstay in oncology for decades. Cisplatin's cancer-fighting power comes with significant side effects. It's highly toxic to the kidneys, so patients receive large amounts of intravenous fluids before treatment. It can also cause permanent hearing loss and ringing in the ears, as well as nerve damage in the hands and feet. Cisplatin is notorious for causing severe nausea, often requiring routine anti-nausea medications. These side effects have driven researchers to develop newer, less toxic platinum drugs. Carboplatin was developed to keep the DNA-damaging power of cisplatin but with fewer side effects. It replaces cisplatin's chloride groups with a ring-shaped carboxylate group which breaks down more slowly. This makes carboplatin much less toxic to the kidneys and ears. However, the trade-off is that it can suppress bone marrow function, often leading to lower platelet counts. Carboplatin is now a mainstay for ovarian, head and neck, small cell lung, breast cancer, and seminoma, and its gentler profile makes it easier to combine with other treatments. Oxaliplatin brought a new structure to the table, a diaminocyclohexene ring, which gives it a different range of activity compared to cisplatin and carboplatin. Most notably, oxaliplatin is effective against colorectal cancer, a type that usually resists earlier platinum drugs. When combined with fluorouracil, it forms the backbone of the FOLFOX regimen, standard for colorectal cancer. It's also used in pancreatic and gastroesophageal cancers. Its main side effect is nerve damage, especially in the hands, feet, mouth, and throat, often triggered by cold. While cisplatin, carboplatin, and oxaliplatin dominate cancer treatment worldwide, other platinum drugs are also in use. Nedaplatin is approved in Japan for lung, head and neck, and gynecologic cancers with reduced kidney toxicity. Lobaplatin is used in China, especially for breast and gastric cancers. Heptaplatin is approved in South Korea, mainly for gastric cancer. Although these drugs haven't achieved the global reach of the big three, they represent ongoing efforts to maintain platinum's cancer-fighting power while reducing side effects. Biggest challenge facing all platinum drugs is resistance. Cancer cells can develop ways to avoid being killed by these treatments. They might reduce how much drug gets inside, pump it back out, or neutralize the platinum before it reaches DNA. Some cancer cells can repair the DNA damage more efficiently, or even lose the ability to trigger cell death when damage is detected. This ongoing battle between drug and cancer cell is a major focus of current research. Researchers are working on multiple strategies to overcome platinum resistance. Platinum Roman IV prodrugs are designed to stay inactive in the bloodstream and only activate inside tumor cells, reducing side effects. Nanoparticle and liposomal delivery systems aim to concentrate the drug in tumors while sparing healthy tissue. New platinum complexes are being developed with additional bioactive components to attack resistant cancer cells through multiple pathways. There's also growing interest in combining platinum chemotherapy with immunotherapy, as the DNA damage from platinum drugs may help tumors respond better to immune checkpoint inhibitors. More than 50 years after an accidental discovery in a laboratory, platinum compounds remain irreplaceable in cancer treatment. The search for the next generation of platinum drugs continues, with scientists aiming to keep their cancer-killing power while reducing side effects and overcoming resistance. The story of platinum in oncology is a testament to the power of curiosity, innovation, and persistence in medical science. Platinum's chemical properties make it especially suited for use in medicine. Its stability and ability to form strong bonds with other atoms allow it to interact with biological molecules in ways that other metals cannot. This unique chemistry is what makes platinum compounds so effective at targeting cancer cells while remaining relatively inert in the bloodstream until activated. Ordination compounds are central to platinum's role in cancer therapy. These are molecules where a central metal atom like platinum is surrounded by other atoms or groups of atoms. The specific arrangement of these groups determines how the compound interacts with DNA and proteins, and ultimately how effective it is as a drug. This field of chemistry has opened up new possibilities for designing targeted cancer treatment. Journey from laboratory discovery to clinical use is long and complex. After cisplatin was identified, it underwent years of testing to prove its safety and effectiveness. Clinical trials involved hundreds of patients in careful monitoring for side effects. Only after rigorous evaluation did cisplatin become a standard treatment, paving the way for other platinum drugs to follow. Key feature of platinum drugs is their ability to form crosslinks in DNA. These crosslinks prevent the DNA strands from separating, which is necessary for cell division and replication. By locking the DNA in place, platinum drugs effectively shut down the cancer cell's ability to multiply, leading to cell death if the damage cannot be repaired. Same properties that make platinum drugs effective against cancer cells can also harm healthy cells. Organs like the kidneys and nerves are especially vulnerable because they have limited ability to repair the type of DNA damage caused by these drugs. This explains why side effects like kidney damage, hearing loss, and nerve pain are common with platinum chemotherapy. Doctors use several strategies to manage the side effects of platinum drugs. Patients receive intravenous fluids to protect the kidneys, anti-nausea medications to control vomiting, and regular hearing tests to monitor for early signs of hearing loss. These supportive measures help patients complete their treatment safely and effectively. Not every patient responds to platinum drugs in the same way. Doctors consider factors like age, overall health, and the type of cancer when choosing a treatment plan. Advances in genetic testing are also helping to predict which patients are most likely to benefit from platinum-based chemotherapy, allowing for more personalized and effective care. Platinum drugs, especially carboplatin, are a cornerstone of ovarian cancer treatment. They are often combined with other chemotherapy agents to increase effectiveness. Many patients with ovarian cancer experience significant tumor shrinkage and improved survival thanks to these drugs, though side effects and resistance remain challenges. Cisplatin and carboplatin are widely used in the treatment of lung cancer, both small cell and non-small cell types. They are often combined with other chemotherapy drugs or targeted therapies to improve outcomes. While not a cure for most lung cancers, platinum-based regimens can significantly extend survival and improve quality of life for many patients. Head and neck cancers are another area where platinum drugs have made a major impact. Both cisplatin and carboplatin are used, often in combination with radiation therapy. These regimens can help shrink tumors, control symptoms, and improve survival, especially in advanced cases. Oxaliplatin has become a key drug for colorectal cancer, especially when combined with fluorouracil in the FOL-FOX regimen. It's also used in pancreatic and gastroesophageal cancers. These combinations have improved survival rates and become standard care for many patients with advanced gastrointestinal tumors. Even with effective initial treatment, some cancers eventually return, a phenomenon known as relapse. This is often due to the development of resistance to platinum drugs. Researchers are working to understand the mechanisms behind relapse and to develop strategies to prevent or overcome it. One approach to overcoming resistance is to combine platinum drugs with other treatments. These might include other chemotherapy agents, targeted therapies, or immunotherapies. By attacking cancer cells from multiple angles, combination therapy can improve outcomes and reduce the risk of resistance. Immunotherapy is an exciting new frontier in cancer treatment. There's growing interest in combining platinum chemotherapy with immunotherapy, as the DNA damage caused by platinum drugs may help tumors respond better to immune checkpoint inhibitors. Early results are promising, and ongoing studies are exploring the best ways to combine these approaches. Nanoparticle and liposomal delivery systems are being developed to improve the targeting of platinum drugs. These technologies aim to concentrate the drug in tumors while sparing healthy tissue, potentially reducing side effects and increasing effectiveness. This is a rapidly evolving area of research with great potential for the future. Platinum Roman-4 prodrugs are a new class of compounds designed to remain inactive in the bloodstream and only activate inside tumor cells. This selective activation could minimize toxicity to healthy tissues and improve the safety profile of platinum chemotherapy. Several platinum Roman-4 prodrugs are currently in clinical trials. Scientists are designing new platinum complexes with additional bioactive components. These compounds can attack cancer cells through more than one pathway, making it harder for the cells to develop resistance. This multi-pronged approach is a promising direction for future platinum drug development. Platinum-based chemotherapy has had a profound impact on cancer treatment worldwide. From testicular and ovarian cancer to lung and colorectal cancer, these drugs have improved survival and quality of life for millions of patients. Their story is a testament to the power of scientific discovery and innovation. Despite their success, platinum drugs are not perfect. Side effects, resistance, and the need for better targeting drive ongoing research. Scientists around the world are working to develop the next generation of platinum compounds, aiming for even greater effectiveness and safety. The story of platinum in medicine began with a simple question: how do electric fields affect bacteria? This curiosity-driven research led to one of the most important discoveries in oncology. It's a reminder that breakthroughs often come from unexpected places and that curiosity is a driving force in science. Behind every platinum drug is a story of patients and families whose lives have been changed. For many, these drugs have meant more time, better quality of life, and hope where there was little before. The human impact of platinum chemotherapy is immeasurable. Few metals have had as significant an impact on medicine as platinum. Its discovery as an anti-cancer agent was a turning point in oncology, and its legacy continues to grow. Platinum's story is a powerful example of how basic science can lead to life-saving therapies. The development of platinum drugs was made possible by collaboration between scientists, doctors, and patients. Clinical trials, laboratory research, and patient care all played a role in bringing these treatments to the world. This teamwork continues to drive progress in cancer therapy. The side effects of platinum drugs have taught researchers valuable lessons about how chemotherapy affects the body. This knowledge has led to better supportive care, the development of new drugs, and a deeper understanding of cancer biology. Every challenge has brought new insights. Clinical trials are essential for testing new platinum drugs and combinations. These studies help determine the safest and most effective ways to use these treatments. Patients who participate in clinical trials contribute to the advancement of cancer care for future generations. With ongoing research and innovation, the future of platinum-based cancer therapy looks bright. New drugs, delivery systems, and combinations are on the horizon, offering hope for better outcomes and fewer side effects. The story of platinum is far from over. The development of platinum drugs is a model for how accidental discoveries can lead to major advances in medicine. It shows the importance of following unexpected results and being open to new possibilities. This spirit of exploration continues to drive progress in cancer research. Bringing a new drug from the lab to the clinic takes years of hard work, setbacks, and perseverance. The story of platinum in oncology is a testament to the value of persistence in scientific research. Every challenge overcome has brought us closer to better cancer treatments. Educating patients and healthcare providers about platinum drugs is crucial for their safe and effective use. Understanding how these drugs work, their side effects, and how to manage them empowers patients to participate in their care and make informed decisions. Support from family, friends, and healthcare teams is vital for patients undergoing platinum chemotherapy. Emotional, practical, and medical support all contribute to better outcomes and quality of life during treatment. No one faces cancer alone. As research continues, the next generation of platinum drugs may offer even greater benefits with fewer drawbacks. Scientists are optimistic that ongoing innovation will lead to new breakthroughs, keeping platinum at the forefront of cancer therapy for years to come. The journey of platinum from a quiet metal to a cancer-fighting powerhouse is still unfolding. Each new discovery builds on the last, and the future holds endless possibilities. Platinum's legacy in medicine is a story of hope, resilience, and the relentless pursuit of better health. That wraps up our deep dive into platinum and its role in cancer therapy. From an accidental discovery to a cornerstone of modern oncology, platinum's story is one of science, innovation, and hope. Thank you for joining us on this journey through the world of oncology pharmacology. Stay curious, and we'll see you in the next episode of Onco-Verse.